Ecostitch is the recent most innovation in the meniscus repair technology. It utilizes the concepts of all inside meniscus repair. It's basically an all inside meniscus repair, but the deploying needle is a solid 1.8 mm needle, which is very small in size as compared to the conventional all inside meniscal repair devices. So it has got a very good pull-out strength, and we can do complex meniscus repairs, bucket handle, radial, horizontal, vertical, all sorts of repair with this innovative device on the medial aspect of the knee and the anterior two-thirds of the lateral meniscus. This is basically, the concept is basically the needle which is used for deploying of the all inside repair are basically loaded on the solid needle instead of the hollow needles of the all inside meniscus repair devices, and this leads to a very strong fixation and a very good pull-off strength. So let's demonstrate the technique, and this is a very good technique. I must say that it is a very good technique to be used by expert knee arthroscopic surgeons for a very strong and secure medial meniscus or a lateral meniscus repair. Thank you. Ecostitch is a state-of-the-art device which is used for meniscus repair. These concepts take care of both the all inside and the inside out concepts, and in this technique you don't have to use any incision on the medial or the lateral aspect. So this comes in a kit which is sterilized, and this is the way that the kit will be supplied. It's a sterile kit and it needs to be supplied with a slotted cannula. The slotted cannula is must, because the slotted cannula will give you an option of taking out one thread while inserting the second thread. So we will be demonstrating the use of this Ecostitch device on a bone model right now. Thank you. So the most important instrument that we need to use is this slotted cannula. So if you see, it's a specific zone specific cannula which is available in 0 degree, 10 degree, 20 degree, 30 degree and 40 degree curve angles, and there is a slot in between from which we can take out the thread, so that when we insert the next thread they don't intermingle with each other. So now I would be going to demonstrate the kit. Now the kit is a sterile kit. We will be opening it on table like this, and this will be supplied like this. So if you see the mechanism, there are basically two long needles, the needles which we use in the inside out repair, but these needles are loaded with anchors which we use in a all inside repair. So technically it's basically an all inside kind of a repair. So what you can see is there is a green thread here and there is a blue thread here, and these both anchors are interconnected with a loop which is seen here. So what we will do is we will just we'll open the kit. Once we open the kit, it is closed like this to prevent any injury to the healthcare professional. We open this kit like this, and at this time we will be having this needle into our picture, and this needle will now be loaded into the meniscus by the use of this particular cannula. So what you need to do is you need to put this needle like this, and we need to pierce the needle like this, and our assistant will pull the needle from backwards. You can see the needle coming out from the back. Take it out, take it out, take it out. Very nice. Now here you can see that the needle has come out, and at this point of time I need to take out my thread from the slotted area. This is a very important step, because when you do this there will be no intermingling of the threads. Just pull a thread a little bit more. Very nice. So this is my first thread which has been gone into the meniscus. At this point of time I will be holding the cannula myself, and I would ask the assistant to pass the second needle through the slotted cannula. Mind you, at this time there should be no wire inside the cannula because we need it to be separate. So once we are very sure that the wire is not in the cannula, we will fire the second needle out, and this needle will be pushed out and again pulled up by our assistant on the posterior medial aspect of the knee. Again we will be taking out the thread like this. Now both of our threads, the green thread and the blue threads, have been pulled outwards. Now what you can appreciate is here, this is the main crux of our repair. So there is one anchor which is loaded on the green and one anchor which is loaded on the blue. So what we will do is we will separate them, both of them. We'll separate both of them like this and take it out. Okay. Now at this time I would ask my assistant to pull them one by one and I would keep my fingers like this. Okay. So I'll ask my assistant to pull blue ones, pull the blue one. Very good. Pull the green one. Pull the green one. Pull the blue one. Very good. Blue, 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 blue. Now there will be a time where both of the anchors will be sitting on the meniscus, and this time you need to just relax a bit. At this time, what you can do is you can hold this knot with your thumb and ask your assistant to pull the green thread a little bit. So once he will pull the green thread, the anchor will be deployed on the back of the, just a little bit more please. So we have to deploy it till the whole of the anchor is out. You can see the whole of the anchor is out. At this time, we would ask our assistant to slowly pull the blue thread as well. If you wish, you can actually put a wire or a marking thread here with a marking pen to realize or to mark that this anchor should not be overshooted far into the knee. So you will ask your assistant to just pull the anchor lightly. The blue one is pulled very lightly now. Slowly we'll pull the blue one out like this. So once we are pulling this out, so now what you can appreciate is both the anchors, the blue anchor and the green anchors, have both been exited on the posterior aspect of the knee. You can appreciate that. Both the anchors are seen on the posterior aspect of the knee. Now, what we need to do is we need to hold both of these threads like this, and then we will be doing the seesaw maneuver like this. So when you do the seesaw maneuver like this, both of the anchors will be deployed on the posterior aspect of the knee, and there will be a knot which will be seen on the meniscus. Here the important portion which you realize is that this is a thicker knot. This is a number 0 suture which makes a very strong knot on the meniscus, and what you can appreciate is both the anchors have been deployed very nicely on the posterior aspect of the capsule, and they have locked very nicely on the posterior aspect of the capsule. So this is a all inside, all suture kind of a repair as far as the meniscus is concerned, and a very good knot is seen inside. If you want to secure the repair, you can take 1 or 2 more half hitches with the use of knot pushers and make it a very solid repair in this position. So we can see that the repair is very good. The anchor is very nicely seen here. The 2 anchors which we have loaded on the posterior aspect of the knee are seen very nicely here. At this point of the time, we will be just cutting it with the scissors. So you have 2 threads here, one the blue one the green one. Now both of these sutures and this needle are basically just the deploying needles. So we have to just pull it down. So you have to just pull it into its place like this to make it free. So you don't need to make any incision on the posterior medial aspect of the knee. You just have to pull it out to get the final repair. So if you can appreciate, you can see a very good final deployed 2 anchors and a very nice knot which is visible right here, and this leads to a very solid repair of the meniscus in this particular scenario. So Ecostitch is a new meniscus repair device which has been under the surgeon's armamentarium, and it is a very useful device which can provide you a very strong repair mind you, because the reason is the needle that we are using in this particular case is a 0.8 millimeter needle. So this makes the smallest possible puncture into the you can see the needle. The needle is very thin needle. So this makes a very small puncture into the knee. So that way the pull out strength of this particular implant is much more than any other comparable all inside meniscus repair device, because in those there are hollow needles which are used, and the diameter of those needles are to the tune of about 1.5 millimeters to 1.9 millimeters to 2 millimeters in some of the devices. So as compared to the conventional all suture devices, this needle makes a small hole into the meniscus, and that's the reason of the success of this repair and a very strong repair that we are able to achieve with this particular technique. Please feel free to ask any questions. We'll be very happy to answer any questions about this innovative meniscus repair technique. Thanks a lot.